More than 2 years into the pandemic, COVID rules have changed a bit thanks to the latest Omicron strain known as BA.4 and BA.5.
Hospitals say they are now seeing patients reinfected within a couple of weeks. Lauren Tallarico has the details you should know.
This week, an update from the Texas Medical Center about the state of COVID in Houston. Hospitalizations have nearly doubled over the last month.
But there's a lot of virus in the community right now.
Dr. Paul Klotman, president and CEO of Baylor College of Medicine, says this is thanks in part to the latest BA.4 and BA.5 subvariants of Omicron, now dominant in Houston.
Antibodies to Omicron do not recognize the mutations in BA.4 and 5.
Which means more people are getting reinfected faster. Here's Dr. Wesley Long, a pathologist at Houston Methodist.
A lot of people had the thought that if they were infected, they might be okay for a couple of months and not be at risk of reinfection. And what we are seeing is that BA.5 can cause reinfections fairly soon after someone has recovered from BA.2.
We're talking a couple of weeks. The good news:
vaccines are still doing a very good job of keeping people out of the hospital.
However, they're not as effective against preventing COVID. An updated version with the newer subvariants will hopefully be out this fall.
The current strategy ain't working.
But Dr. Klotman says although they're still the best bet, he'd like to see more being done to create a better vaccine that doesn't just chase ever-changing variants.
In the history of vaccines, first-generation vaccines save a lot of people, but they're usually not the best vaccine. I mean, you can use the polio vaccine as a perfect example. The killed vaccine saved a lot of people, but wasn't until the live attenuated Sabin vaccine came along that it was really cured.
For now, a cure for COVID doesn't exist. So during this wave, doctors say get boosted and mask up around crowds. I'm Lauren Tallarico, KHOU 11 News.